Mr. Boss Mustapha, distinguished senators here present, honorable members of the National Assembly, the Honorable Minister of Health, Dr. Osage Hanire, Honorable Minister of State for Health, Dr. Senator Adeleke Mamora, the Executive Director, National Primary Healthcare Development Agency, other dignitaries here present, permit me to stand on existing protocols. First, I must welcome you to the Federal Medical Centre Abuja, which is one of the tertiary health facilities in this country that offers very quality healthcare services. The choice of this particular facility for the launching or the flag of the phase 2 of COVID-19 vaccine in this country is quite welcome, and we thank the Presidential Steering Committee and the Executive Director, National Primary Healthcare Development Agency, for this honor. We all know that prevention is really better than cure. And COVID-19 came, and we have seen the way this nation, led by the then Presidential Task Force, with the Federal Ministry of Health, other development partners, the healthcare workers, everybody came on board, and we were able to do very well. The uptake of the first phase of the vaccination was quite good, and this is quite commendable. That cannot be achieved without really creating the necessary awareness, amongst the populace. So this is quite commendable. And we are here today for the flag off of the phase 2 of the COVID-19 vaccination across the country. On behalf of the staff and management of Federal Medical Centre Abuja, I once again welcome you to this national flag off of COVID-19 vaccination. Thank you very much.
Honorable members of the House of Representatives, the Secretary to the Government of the Federation, and the Chairperson of the Presidential Steering Committee on COVID-19, Honorable Ministers, the Executive Director, National Primary Healthcare Development Agency, Director General of the Nigeria CDC, distinguished ladies and gentlemen. Let me start by extending my appreciation to Mr. Boss Mustapha, the Secretary to the Government of the Federation and Chairperson of the Presidential Steering Committee on COVID-19, the Honorable Minister of Health, Dr. Osage Hanire, the Honorable Minister of State for Health, Dr. Senator Mamora, the members of the Steering Committee, and Dr. Faisal Shuaib, Executive Director of the National Primary Healthcare Development Agency, for inviting me to participate and speak at this very important event to mark the flag off of phase 2 of the COVID-19 vaccination program in Nigeria. I must say that I'm very pleased to be here. For us at the African Union's Africa Vaccine Acquisition Task Team, AVAT, it is very commendable that the government of Nigeria has given the vaccination program such a priority. We all know that adequate vaccination of our population is the right economic recovery strategy. It is the key to reopening our economies and the key to return the economies to sustainable development. At Afreximbank, we are delighted to be supporting the continent's effort through AVAT to enable the achievement of this objective. We are pleased to have provided the $2 billion that made it possible for the African Union to achieve its objective of a whole of Africa pooled procurement approach, which will allow every African country to access the COVID-19 vaccine at the same price, irrespective of their size or location, whether they are an island state or on the mainland. The 400 million doses of COVID-19 vaccine procured under this arrangement will cover 30% of Africa's population, halfway towards achieving the 60% vaccination coverage recommended by the Africa CDC. It is our expectation that the COVAX facility will cover the remaining 30% in line with the commitments they have made to the world and to Africa. We are pleased that among the COVID-19 vaccines being flagged off today is the single-shot Johnson & Johnson vaccine procured through AVAT. Nigeria received 177,600 doses last week, and we have received a total of 1.1 million doses by the end of August or beginning of September. We are also committed to delivering the Johnson & Johnson COVID-19 vaccine every month to participating states until Q3 of next year, when the entire committed doses and doses on option, totaling 400 million, will have been fully delivered. As part of our efforts, we have mobilized those sharing of vaccines, having negotiated along with the COVAX facility with the United States government and the French government. In this regard, we are pleased that among the vaccines being flagged up today are the 4 million doses of Moderna vaccines received by Nigeria for the United States. And I must say thank you to the U.S. government representative here. Similarly, we continue to mobilize donations of COVID-19 vaccines through various sources, including $700 million donation received from Mastercard Foundation and the $25 million donation received from the MTN Group. Nigeria and other participating states under the AVAT arrangement will start receiving the Mastercard Foundation and the MTN donations from November 2021. At AVAT, our approach is that only countries that have paid for their vaccines orders will receive donated vaccines. We are pleased that Nigeria demonstrated a strong commitment to ordering vaccines, committing a total of about $300 million for the orders they have made. This will deliver about 40 million doses. This will deliver about 40 million doses from now till the end of the third quarter of 2022. These vaccines will vaccinate 40 million people and complement other sources, including the COVAX facility. In closing, I would like to once again commend the efforts of the Nigerian government in responding to the COVID-19 pandemic. The AVAT and the Afreximbank will continue to support this effort. Afreximbank is proud to do so as Nigeria is a very supportive shareholder of the bank. And indeed, made it possible for Afreximbank to put in place the $2 billion that has made it possible for us to make the orders that we are beginning to deliver now. We hope that we will continue to support the various countries in Africa so that should booster doses be needed, that Africa will not be left behind. Once again, thank you very much for the opportunity, and I wish you a successful event. Thank you.
Distinguished senators, honorable member of House of Representatives, the Secretary to the Government of the Federation, and Chairman of the Presidential Steering Committee on COVID-19, honorable ministers, Director Generals, other directors, other dignitaries, ladies and gentlemen, members of the press. On behalf of the partners supporting the COVID-19 vaccination rollout in Nigeria, I want once again to congratulate the government of Nigeria through the Presidential Steering Committee, the Federal Minister of Health, NCDC, NPSCDA, for an exemplary response to COVID-19, including successfully vaccinating over 2.5 million and 1.4 million persons with the first and second dose of the AstraZeneca vaccine, respectively, in phase 1 rollout of COVID-19 vaccination. More encouraging is the fact that the country, during that first phase, utilized 98.9% of the first tranche of COVID-19 vaccine that were received. Today, we are gathered to launch the phase 2 of COVID-19 vaccination with an initial 4 million doses of Moderna and 176,600 doses of Johnson & Johnson vaccine, which will be administered to people aged 18 years and above in the 36 states and the Federal Capital Territory of Nigeria. The introduction of these vaccines comes with a huge logistical preparation for the storage, particularly for the Moderna vaccine. I would like to congratulate the government of Nigeria for this important milestone. We partners, we are indeed very happy with the federal government of Nigeria huge investment in procurement and installation of ultra-cold chain equipment at the National Strategic Store and the State Cold Store. This is a good sign of a committed government leadership at national and state level to have its citizens vaccinated against COVID-19. Going by the lesson learned from the phase 1 of COVID-19 rollout, we have no doubt in our mind that government of Nigeria should be able to overcome challenges for a successful phase 2 rollout. Of course, this is a partnership, particularly with you here, member of the press. It's being proposed, for example, to integrate primary health care services with COVID-19 vaccination at fixed posts, otherwise called whole of family approach. This intervention, if properly implemented, will ensure clients are not denied routine primary care services during COVID-19 vaccination, improve the country's health indices. As I always mention at different fora, vaccines are a critical tool in the battle against COVID-19. These vaccines are safe and effective and will be the game changer. But for the foreseeable future, we must continue wearing masks, physically distancing, and avoid crowds. We would like to remind everyone that most countries, including Nigeria, are currently experiencing the third wave of COVID-19 pandemic, and some are even in the fourth wave. We would like to call on everyone aged 18 years and above that is yet to take the COVID-19 vaccine to come out and get vaccinated, and by so doing, help to interrupt the community transmission of the diseases. Partners will continue to support the country in reaching its target population with safe and effective vaccine. No one will be safe until everyone is safe. I thank you for your attention.
Members of the House of Reps, Secretary to the Government of the Federation and our Chairman of the Presidential Steering Committee, Honorable Ministers, President of Afro-Exim Bank, colleagues, co-directors, heads of agencies, and of course, our host, my brother, Dr. Faisal Shoaib, ED of MPACDA. I've stepped down my written comments to just focus on one point as we open today's event. Vaccines have a long trajectory from development to acquisition, which our colleagues at MPACDA and all our partners have supported us with. And then the regulatory process, and we'll hear from DG NAFDAC in a few minutes. But the next step of this will depend on healthcare workers. The distribution and making these vaccines available to the last mile will depend on an incredible group of Nigerians that have been working hard for the last 18 months to deliver vaccines, to test people, to do contact tracing, to treat individuals. Our treatment centers are filling up again. Healthcare workers are working through the night, every day, making sure they serve Nigerians. So as we celebrate the acquisition of these vaccines today and begin the second phase of distribution, I'd like to acknowledge all the healthcare workers across our country that have been working so hard in this response and will continue working hard, and ask Nigerians please to keep supporting them as they deliver on these vaccines. As we start queuing up from tomorrow to get vaccinated, please be patient. Be patient with our colleagues, line up carefully. They will get to everyone. Across every state in Nigeria, healthcare workers are preparing as we speak to deliver these vaccines to Nigerians. Let's work with them, let's support them, let's encourage them. Let's not be disruptive, and let's really put hands together to continue working as we have from the beginning of this response. It's a big country. It's not easy to get to everyone in the next few hours. So people will have to be patient as our colleagues work very hard with colleagues in the ministries of health at the state level, state primary healthcare boards, local government workers, hospital workers, nurses, doctors to deliver these vaccines safely. So today, as we launch the second phase of our vaccination campaign, really give a shout out to all the healthcare workers across the country that work for us every day, keep this response going, and from tomorrow we'll have the added responsibility of delivering these vaccines into arms across our country. So thank you very much. Let's keep pushing on this response. We're not out of it. And ensure we continue to deliver an excellent response for our country. Thank you.
Led by the Senate President, but represented by Senator Utazi, the Secretary to the Federal Government of Nigeria, Mr. Boss Mustapha, the Ministers of Health, Federal Ministers of Health, the members of the press, ladies and gentlemen. Here we are, the second phase of the vaccine rollout. NAFDAC has been preparing for this for about a year now. So you can ask yourself, why should I take the vaccine? Because NAFDAC certified it. Why should I take the vaccine? Because NAFDAC has been working around the clock to ensure that the health of our people is premium in whatever we do. Why should I take the vaccine? Because NAFDAC is the only agency in the world that is using track and trace to monitor where each vaccine vial goes. And they now call it the Abuja principles. When the Moderna vaccine came from the US, we knew that the barcoding was not complete, so we had to have an emergency meeting to ensure we put the barcoding that will enable NAFDAC to track and trace. Our staff, about 30 staff, NAFDAC staff, have been working around the clock since Wednesday so that today will happen. But it's not just that. Any vaccine that comes to Nigeria, we have to test it. That is why you should go and take your vaccine, because we spend so much time on it. When you take your vaccine, you may have a little bit of fever or rash or whatever. We have the Med Safety app. You can download it on Google. If you have iPhone or Android, you can download it. You can self-report the type of side effect you are having. Why is that so important? It is important because as regulators, we have to record what side effects are being reported across the world so that we can safeguard the health of people going forward. This is an emergency use authorization that we're giving. When we're going to get the full approval, it is the data that we get that is going to guide us. Why should you take the vaccine? Is because NAFDAC safeguards the health of our people. It is premium. Thank you very much.
The United States President committed to donate at least 80 million vaccines from the U.S. supply to countries throughout the world. To date, over 110 million doses of COVID vaccine have been donated to more than 60 countries worldwide. This donation of 4,080,000 doses of Moderna to Nigeria are a fulfillment of that promise and a clear commitment from the U.S. government to lead the fight against the coronavirus pandemic. In addition, since the onset of the pandemic in Nigeria, the U.S. has provided more than $73 million in COVID-19 assistance, from the deployment of personnel to support the response, to the delivery of a mobile field hospital right here in FMC Jabi, to additional more than 200 ventilators, personal protective equipment, and other COVID-19 control measures. To date, over 180,000 Nigerians have been reported to be infected with COVID-19, and nearly 2,500 have died. We mourn the lives of those that were lost because they could not benefit from the vaccines that we're sharing today. But we are thankful for the ingenuity of the scientists and the commitment of the American people that allows us to be in a position to help others today by donating 4 million doses. We're also thankful for our colleagues from UNICEF and the WHO for their partnership in ensuring the timely delivery of vaccines. I want to congratulate Nigeria for Nigeria's leadership in being ranked number 4 in the world in the overall COVID response. We also want to congratulate Nigeria for the arrival of 170,000 doses of J&J vaccines purchased through the AU and millions more that will come. I want to reiterate that the United States stands ready to leverage all resources, including those already in country, for example, PEPFAR resources, to support the rollout of phase 2 vaccinations. This is how important it is to the US government. I want to conclude with a message for all who are listening. COVID-19 does not respect anyone. Please wear a mask, practice regular hand washing, and avoid crowds to minimize the spread of this strain. Lastly, you must know 95% of those who continue to be infected with COVID-19 and die from COVID-19 are unvaccinated. These are people who either chose to not be vaccinated or could not benefit from vaccines. Therefore, I'm taking advantage of this opportunity to strongly encourage you, to plead with you, take advantage of the vaccines that are available in Nigeria. God bless and good day.
The distinguished President of the Senate, other members of the National Assembly here present, the Secretary to the Government of the Federation, honorable ministers here present, distinguished guests, ladies and gentlemen. I stand before you to speak on behalf of the Nigerian media. The media, along with healthcare workers, is a frontline element in the battle against COVID-19. We have been consistent in our contribution to the fight against COVID-19, right from the inception of the Presidential Task Force to date. During the launch of the first phase of vaccination against COVID-19, the media was again very visible in the sensitization campaign mounted to ensure that Nigerians benefited from the vaccines. This is the launch of the flag-off of the second phase of the vaccination against COVID-19. And again, the media is a frontline element in sensitizing Nigerians, to the effects of the vaccine. We are co-contributors with healthcare deliverers in the campaign against COVID-19. And without sounding immodest, yes, Nigeria was rated number 4 globally, and I think the media should stand to be counted. We were there with all the frontline workers. Again, I would like to assure on behalf of my colleagues in the media that we will be there as we've always been in the fight against COVID-19. I would like to thank the chairman of the Presidential Task Force, Secretary to the Government of the Federation, for the confidence he has reposed in the Nigerian media. And I would like to assure him and all others who are engaged in the fight against COVID-19 that in the media, you have a shoulder to lean on. I thank you very much.
The chairman of Presidential Steering Committee, aka Presidential Task Force, Associate Dr. Barrister Boss Mustapha, who happens to be my schoolmate, honorable ministers here present, all heads of MDS here present, and the media. I want to quote from the person I'm representing here, who is the Right Honorable Speaker of the House of Representatives, Right Honorable Femi Bajabiamila. He said, and I quote, "This is a time for everyone to fully rally around the government. The vaccines being introduced in Nigeria are very safe and effective." And it was a well-informed advice before he made that advice. Now, I want to thank Mr. President, who heads the executive arm, for what they have done to come number 4. I think it's one of the good news that you hear about Nigeria. I want to thank the National Assembly for also supporting, and all Nigerians. MC, if you notice when you said we should all lift up our arms, those that have had their immunizations, I even have my card here. Most of your members here, none of them lifted their arms up. And as the DG, NTA said, you are among the front lines. Dr. Faisal, make sure all the media, please, you arrange a special program for them to be immunized. Secondly, I want to advise, or rather say, and it is from the Speaker, that if we are to move forward and to keep this kind of intervention sustainable, Nigeria must begin to manufacture vaccines. Since the SGF is here, the ministers are here, the MDS responsible are here, I want to say, Mr. President, the way forward is to start manufacturing vaccines so that we too can start donating vaccines to poorer countries like America has done. Thank you very much.
Well spoken, Honorable. I do hope that when that budget comes to the House, it will also receive accelerated hearing. All right, it's one big family here, and what we are doing is ensuring that we contain COVID-19 in all forms. At this point, I'd like to call on my brother, who is the Chairman, Senate Committee on Health, Senator Dr. Ibrahim Oloriegbe, to give his own goodwill message.
My colleague, the Chairman, Senate Committee on Primary Healthcare and Communicable Disease, Senator Utazi, the golden voice of the Senate. My colleague and brother, Dr. Arun Shelia, Chairman, House Committee on COVID-19. My colleague again, because being an associate, is also, is a member, the Secretary to Government of Federation and Chairman, Presidential Steering Committee, who we have honorably given the honorary degree of Masters of Public Health. The Honorable Ministers of Health, Head of Federal Government Agencies, Development Partners, distinguished ladies and gentlemen, gentlemen of the press. Good morning. My message this morning will be in twofold. One will focus solely on the COVID-19 and the vaccines. And I want to start by expressing that I'm a proud Nigerian. I'm proud because a lot of times, particularly the media, what makes news is the negative. But this time around, we have positive news from Nigeria. COVID-19 is a major event in the world because it has affected, just like I would say Dr. Bosman always says, it affects both our livelihood as well as our health. Because it doesn't only affect our health, it affects the economy. And if as a country, among the Committee of Nations, almost 200 countries, we are rated fourth, it's worth celebrating. And I'm proud to be in Nigeria. To achieve this is from the cooperation of all Nigerians, the government, our partners and friends across the world, and we need to sustain it. The war or the battle is not over yet, and part of it is why we are here with the vaccines. Previous speakers have emphasized the importance of Nigeria taking the vaccine, and I want to join them that we should all, as Nigerians, avoid ourselves this opportunity. The vaccines are safe, as you see when the MC asked all of us on this side, most people here raise their hand. And it's becoming more important an international factor now. If you want to travel across the border, we've said this severally, you cannot cross the border of Nigeria into many countries these days without you being vaccinated. But far and beyond that, for our own health, for our living, and for our livelihood, we have to take the vaccines. Related to that, just for me to respond that in achieving this, National Assembly has been a great partner with the executive. We not only appropriate, we also oversight effectively on what is happening. And this oversight is in a collaborative manner. We interacted effectively with both the ministries and Presidential Steering Committee. And we demonstrated this even with the vaccines. When the executive proposed and sent us the supplementary budget for the vaccines, we processed it in very good time. Within 2 weeks, the budget was sent back and the president has signed it. And just like the president of Afrexim said, if a country did not pay for its vaccines, it won't get donation. Nigeria has already allocated and we have already opened account and paid for our J&J vaccines. As such, it's part of what we are receiving. So as such, all Nigerians will cooperate with the government and health workers by affording themselves the opportunity of taking the vaccine. Also, as National Assembly, we are working on Nigeria producing vaccines. Already since 2020, we have allocated resources to commence that process, and we are working with the Federal Ministry of Health. So just like my previous colleague has said, we are on the verge of producing vaccines in Nigeria. 10 billion naira was allocated in 2020 budget. In addition to that, we have Nigerians who are international community who are working with us, with our international partners, to ensure that we have a mechanism to produce vaccines. The process has already started before. We are only trying to move it forward, and I want to assure us that in no distant future, Nigerians will start to produce vaccines locally and will not depend on donations again. My second part and final part of my message is that as we speak today, we have some component of health workers who are not working. And for vaccine delivery, for healthcare delivery, we need health workers. Human resource is a huge challenge in our country. I want to call on our colleagues who are on strike to please afford themselves all the opportunity of negotiations that we have had and the opportunities that government has given. The resources or the money they're asking for has already been provided and is being processed. So ask the resident doctors to please go back to work. And I want to assure all Nigerians that as National Assembly, we are working collaboratively with executives and other stakeholders to resolve these human resource challenges in Nigeria. It's a huge issue because if you have the money, if you have the materials, we need the men to get healthcare delivered. And we assure Nigerians that we shall handle this. Thank you very much. God bless the Federal Republic of Nigeria.
Thank you very much.
Ably represented here by the chairman of the Senate Committee on Primary Healthcare and Infectious Diseases, members of the National Assembly here present, the Secretary to the Government of the Federation and Chairman of the Presidential Steering Committee, honorable ministers here present, distinguished ladies and gentlemen, in the interest of time, let me rest on already established protocol. It is with great pleasure that I welcome you all to the national flag-off of the Phase 2 COVID-19 vaccine rollout in Nigeria. This flag-off is necessitated by the need to create awareness on what we'll be doing differently to ensure a more successful campaign. Permit me to start by expressing our profound appreciation to the President of the Federal Republic of Nigeria, His Excellency Muhammadu Buhari, for his fatherly commitment to the cause of COVID-19 vaccination in the country. It is gratifying to mention that the support of our dear President has been without limits to ensure that Nigerians are protected against COVID-19 disease. I commend our health workers for the professionalism, dedication, and resilience they have continued to show by staying on course to deliver COVID-19 vaccines to eligible persons despite the pressure of disinformation from within and outside the country. It is important to also mention that without our dedicated and hardworking staff at NPHCDA, NCDC, NOA, the National Orientation Agency, NTA, FRCN, the Federal Ministry of Health, the Federal Ministry of Information and Culture, the media, and the tremendous support of our development partners, the country could not have successfully utilized the COVID-19 vaccines we received from the COVAX facility for our first phase of the vaccination program. Although Nigeria is rated as one of the best performing in the vaccination response, we are not satisfied because we know we can be the best. We thank the government of the United States for its magnanimity in donating 4,080,000 doses of the Moderna COVID-19 vaccine, which we received on the 1st of August. This was followed last week with the arrival of the 177,600 doses of the Johnson & Johnson vaccine, which is the first tranche of the almost 40 million doses that we've procured through the Afrexim Bank. The balance of the vaccine will be delivered over the coming months. We sincerely appreciate Afrexim Bank President and his team for working tirelessly to ensure that the African countries are not shortchanged in access to life-saving COVID-19 vaccines. Because the Johnson & Johnson vaccine is a one-dose effective vaccine, the 177,600 doses will be focused on those who live in hard-to-reach areas. That is to say, those that live in riverine areas, desert areas, mountainous areas, security-compromised areas. This is because they are the people who may find it difficult to leave their homes to the health facility for the second dose vaccination. We will also be receiving today 698,880 doses of the AstraZeneca vaccine, a donation from the UK government through the COVAX facility. These doses will be targeted at those that are due for their second dose of the AstraZeneca vaccine. In the next couple of weeks, we'll be expecting up to 3.9 million additional doses of the AstraZeneca vaccine to complement what we already have and to ensure that we cover not only those who will be taking their second doses of the AstraZeneca vaccine, but for those who would prefer to take their first doses as well. As a result of the leadership provided by the Presidential Steering Committee, the Federal Ministry of Health, MPH-CDA, in collaboration with our partners, have mapped out the best strategies in targeting different segments of our populations because of the differences in vulnerability, age, and geographical constraints. In preparation for the commencement of the phase 2 vaccination, we have trained over 40,000 state-level personnel comprising our health workers, partners, in order to capacitate them for this rollout. We are fully aware that because Nigeria has started receiving different brands of COVID-19 vaccine, a lot of questions and concerns are being raised on what brand of vaccines are best in terms of safety and effectiveness. We are also aware that mischief makers are still around the corner to take advantage in crafting false information to mislead people on the vaccination. I want to assure all Nigerians that all brands of the COVID-19 vaccine used in Nigeria has been certified by NAFDAC. They are safe and effective, especially against the Delta variant. Distinguished ladies and gentlemen, we believe that overcoming misinformation and disinformation will not only enable us to overcome vaccine hesitancy, but also facilitate recovery from economic downturn imposed by COVID-19 in the country. Our Crisis Communication Center is therefore firmed up to deliver rapid data analysis for intensive public information management on COVID-19 vaccination in the country. Finally, I want to commend everyone who has taken the vaccine and appreciate others who have supported the course of COVID-19 vaccination in Nigeria. To those of us who have taken the vaccine, I would like to encourage us to speak to our loved ones, our friends, colleagues, and encourage them to get vaccinated. Because for us to stop this pandemic, we need a critical herd immunity that can only be approached when we reach at least 70% herd immunity. It is the responsibility of all Nigerians to ensure they disseminate the right information to their loved ones and community members and advocate that people should take the vaccine so that we can continue to build our immunity and eventually return to our normal ways of living. Even after vaccination, let us continue to observe the non-pharmaceutical measures such as wearing of face masks, physical distancing, and hand hygiene as we work together to fight this pandemic. Thank you. God bless you. God bless Nigeria.
For what you have continued to do for us in terms of this fight against COVID-19. Permit me to just say, Your Excellencies, distinguished ladies and gentlemen, let me say up front that in addition to what DG NAFDAC, Professor Moji Adeye, said as reasons why you need to take the vaccine, in addition, I think the most important reason why you need to take the vaccine is that it offers the greatest chance of survival even if you are infected with the COVID virus. And that is the reality. We do know of prominent anti-vaxxers, if you follow global news, who have succumbed. Most unfortunately, in their dying bed, they were advocating that members of their family and other people should take the vaccines. I think that is instructive. Having said that, this is indeed a great moment for our dear country, Nigeria, in the collective fight against COVID-19 pandemic. You will recall that the first phase, COVID-19 vaccination, was closed in July after we have utilized all available vaccines in the country. About 3 weeks after, we received about 4 million doses of Moderna, followed by over 177,000 doses of Johnson & Johnson, which the ED, National Primary Healthcare Development Agency, did mention earlier. There is therefore no gainsaying that government is determined to ensure that all eligible Nigerians are vaccinated within the shortest time possible so that we can achieve our desired herd immunity. The onus, therefore, lies on every citizen to ensure that he or she gets vaccinated with their families and communities. The third wave of the COVID-19 pandemic is definitely here with us. And this is a warning to us that indeed it is not over until all eligible Nigerians receive the life-saving vaccines. We did not overemphasize that no one is protected until everyone is protected. As leaders and individuals, we all have a responsibility to ensure that we encourage our families, wherever they are, to get vaccinated and continue to observe the non-pharmaceutical interventions. And I can assure you that in the spirit of global solidarity and national unity, working together and taking responsibility for our individual health, we shall overcome. Thank you very much.
To recognize the representative of the Senate President, the Secretary to the Government of the Federation, distinguished senators, Honorable Minister of State who just stepped out, the Executive Director of MPCDA, other directors here present, ladies and gentlemen. I will be very quick in the interest of what is threatening us from the weather. And it is my pleasure to join others to welcome you to this very happy event, which is the flag off of what we call the phase 2 of the COVID-19 vaccination in Nigeria. Since that first case we recorded in February 2020, and with increasing understanding of the nature and behavior of coronavirus, the government has continued to strengthen measures to protect lives and also livelihoods to mitigate the impact of this disease. There are many measures we have been taking, and all of them bear emphasis, particularly the non-pharmaceutical interventions and the public health measures that have been well advertised. Now, a very important one is this vaccination, about which a lot has been said today. It is very important to have this gathering. First, to appreciate the donation that has come to our country by way of the United States government, and also the effort of the government to make its own acquisition from the AVAT tax team. And secondly, to let all Nigerians know that these vaccines are safe and they have been tried and tested. We have not lost anybody to it in Nigeria. There are people who have had small complaints, but none of them has been fatal. And then to urge everybody to participate, we are looking for at least 70%. And the way things look, because we observe what goes on in other countries, it will probably need more than 70% of our citizens to give us herd immunity. There are countries today which are still suffering despite a large percentage of vaccinations. Those who have had 60% are still having very high cases, and their health systems have been overwhelmed. Our health systems are still standing up, and even though we have been commended for the response so far, it is dangerous for us to rest on our oars. We need to continue to work together. It is not the work of government alone. All of you, all Nigerians are involved. And particularly all of you who are here in the media, who send out the messages to tell the citizens that it is a job for everybody. Nobody is exempted from it. Wear your mask, observe social distancing, know that we are fighting a very dangerous disease that changes its forms. The mutation that gives us concern. Right now we are dealing with the Delta variant, and those of you who are watching the news, international news, will have seen the havoc that it did in India and in other countries. We do not want to get in that situation, and that is why this vaccination is extremely important for everybody to take seriously. It has been tested, and the MPHCDA has prepared very well to deliver it. As has been said, some vaccines are reserved for hard-to-reach areas, security-compromised areas, and also itinerant workers and nomadic people who will not get a second chance for a second vaccine. So the plans are very intricate and very well laid out. All we need now is the appeal to all citizens to work with us, to continue with the non-pharmaceutical interventions and make sure that we get to where we are going at a little cost of loss of lives or loss of livelihood. And that will be all I need to say. And to also here introduce and present this COVID-19 vaccination in Nigeria field guide. It has been prepared for health workers and for the delivery of these vaccines to Nigerians in the most effective way. As has already been indicated, Nigeria is also working on being a production site for vaccines. We are working with eminent Nigerians, and we have been working also with National Assembly to get the resources. And it will also require technology transfer and a considerable investment from countries with whom we're already in touch. And so with that, I would like to invite all those who are participating in this launch. The Executive Director, distinguished senators, SGF,
Take that shot. Stand there and take. Hey! Take the money. Take.
Thank you. Come rain, come shine, Nigeria is resolved to beating COVID-19. I know that
heads of government agencies here, starting with the host the ED of the National Primary Healthcare Development Agency, our development partners, the President of Afri-Exim Bank, in absentia, distinguished ladies and gentlemen, invited guests, gentlemen of the press. Permit me to please stand on existing protocol already established. Before I read my prepared text, I want to take this opportunity to truly thank the leadership of the National Assembly, particularly for the support and the cooperation we have received from the National Assembly in crafting the national response to COVID-19 and its execution. I also want to extend our gratitude to our development partners for the solid support and confidence they exhibited in the then Presidential Task Force and now Presidential Steering Committee, and in convincing their nations and agencies to grant Nigeria maximum support in our activities as we approach a virus that was novel and unknown to the entire world. I will not end my expression of gratitude without thanking the members of the press. The members of the fourth realm, you've demonstrated patriotism and you've engaged in this response as you've never done before. You have toiled day and night. You've been in the front line. You've committed yourselves, and some of you paid the supreme sacrifice. To the health workers of Nigeria, we remain eternally grateful for your services. And I will lend my voice to the appeal of distinguished Senator when he called on the members of the Nigerian Resident Doctors Association to respond to every invitation of negotiation and discussions so that we can bring to an end the current strike action that is affecting our health administration infrastructure. Having said that, let me now go to my prepared text and express the fact that it's an honor and privilege to address you at this auspicious national flag-off aimed at informing Nigerians that we are commencing another phase of our four-phase strategic vaccine rollout plan. I also want to appreciate all Nigerians, especially those who have received their full 2 doses of AstraZeneca vaccine during the first phase, which closed in July. As you are aware, the third wave with the Delta variant of the virus is here with us. This has resulted in upsurge of COVID-19 cases in the last few weeks. The arrival of 4,080,000 doses of Moderna vaccine donated by the government of the United States and the 177,600 doses of Johnson & Johnson vaccines out of the 29+ million doses the federal government has purchased through the African Import-Export Bank and the African Union is highly encouraging and motivating for us at the Presidential Steering Committee. Your Excellencies, distinguished ladies and gentlemen, I want to assure you that the federal government is committed to ensuring that Nigerians have unfettered access to COVID-19 vaccines as the country will continue to invest in and access safe and effective vaccines. It is now the responsibility of every citizen to register and get vaccinated so that we can achieve our desired herd immunity of vaccinating at least 70% of our eligible population. The Presidential Steering Committee will continue to monitor with concern the increasing trend of COVID-19 cases in several countries, with special focus on those with high incidence rate and widespread prevalence of variants of concern. While government deeply empathizes with families who have lost loved ones to this virus and assures them that we will continue to do everything possible to minimize the surge of COVID-19 cases in Nigeria, citizens are strongly advised to minimize all non-essential international travels by land, air, or sea at this time, especially to countries that are showing rising numbers of cases and deaths from COVID-19. Consequently, restrictions are placed on travelers from Brazil, India, South Africa, and Turkey into Nigeria in line with our travel guidelines. Individuals, transporters, and airlines who flout the guidelines shall be sanctioned. State governments are required to ensure all returning travelers from all these countries adhere to the mandatory 7-day self-isolation period and the repeat of the COVID-19 PCR test on the 7th day after arrival. Violators will also be sanctioned accordingly. Distinguished ladies and gentlemen, we all have a responsibility to safeguard the health of our people by ensuring that all eligible persons in our homes and communities get vaccinated with the COVID-19 vaccines, while government will continue to ensure sustained availability of the vaccines. The onus is on eligible citizens to demand for, make the extra effort to access the vaccines and get vaccinated. These vaccines are safe and efficacious, and it is our only hope out of the pandemic for now. Let me emphasize, I've said it quite often, that very soon, when the developed countries that are manufacturing these vaccines are able to vaccinate a substantial number of their population, vaccine mandate will become the norm all over the world. So it is in your personal interest as a Nigerian, when the vaccines are made available, for you to ensure that you get vaccinated as quickly as possible. Because very soon, you will not be able to travel the world unless you produce an evidence of the fact that you've received vaccination. The first phase of our COVID-19 vaccination and the entire national response has been adjudged by WHO and other development partners to be very, very effective and one of the best in the world. This is very heartwarming. However, we acknowledge that there is still room for improvement. I commend the National Primary Healthcare Development Agency and our partners for the various initiatives they have introduced to address vaccine hesitancy, which was one of the greatest challenges encountered during the first phase. We invite all hands to be on deck to fight vaccine hesitancy in order to free our country and the rest of the world from this pandemic. I therefore urge all stakeholders to mobilize their community members aged 18 years and above, especially the elderly, to get vaccinated against COVID-19 to stop the transmission of the virus, as vaccines is pivotal to our efforts at containing the spread of COVID-19. It is therefore imperative that even after vaccination, you will continue to observe the non-pharmaceutical measures, the wearing of masks, washing of hands frequently, maintaining physical distancing until we have vaccinated enough eligible Nigerians to achieve herd immunity. I sincerely commend all our stakeholders, especially our governors, for the demonstration of sterling leadership by example and for the oversight during the first phase of the administration of the vaccines. As the second phase of vaccination commences today, I believe our governors and all those in leadership positions will intensify mobilization efforts and continue to facilitate the vaccination of eligible persons in the states and the local governments to ensure all allocated vaccines for the second phase are fully utilized, just as we did during the first phase when we had 100% utilization of available vaccines. Having said that, let me continue to urge Nigerians that COVID-19 is nowhere gone. It's still very, very much around with us. And we must continue, I emphasize, that the only way to safeguard ourselves and our loved ones is to continue to adopt the non-pharmaceutical measures, which is the most likely cure we have for now. Wearing a face mask or any form of covering, washing our hands or use of sanitizers, maintain social distancing or physical distancing, and let's avoid large congregations for now. It is therefore my singular honor and privilege to officially flag off phase 2 COVID-19 vaccination in Nigeria on this day, Monday, 16th August 2021, to the glory of God and for the benefit of mankind. I thank you for your kind attention, and God bless the Federal Republic of Nigeria. Thank you. Are we beginning? Yes.
Thank you, class, for the dynamic chairman, Presidential Steering Committee on COVID-19, and Secretary to Government of the Federation. At this point, I'd like to invite the representative of the Senate President, himself, Chairman, Senate Committee on Primary Health.
Thank you. First of all, I want to not stand on the established protocols, but align myself with the well-established protocol by Mojisola. Having said that, before I read the prepared speech of Mr. President, or Mr. President of the Senate, I have to, because I'm wearing two caps, I'm the chairman, Senate Committee on Primary Healthcare and Communicable Diseases, and a representative of the Senate President. With the Executive Director of Nigeria Primary Healthcare Development Agency, we are actually playing host to this very, very important function. And I have to say that in that capacity, that one of those measures to assess a leadership anywhere in the world is the capacity of that leadership to recruit the right kind of people to man different areas as far as of that administration. If he succeeds in that, he has succeeded in everything. And if he fails in that, he has failed in every other thing. Why I've said so is because it is the capacity of Mr. President to assemble the war room to face COVID-19 pandemic in the country in the area of a presidential task force that has changed, that has also mutated to now presidential steering committee that has led to the success of this effort in this country. that has led to the essence of success that the World Health Organization has recognized Nigeria as a fourth in the global response. So we are very happy about this committee, this capacity Nigeria has exhibited. This is not the first time Nigeria has done that. They have done it during the Ebola, the period of Ebola. And today, Nigeria has repeated it, and we have made history. Having said that much, let me get to the speech of the President of the Senate, who would have wanted to be here in person because of his commitment and the commitment as the chairman of the National Assembly to the effect that health of Nigerians remains a priority of the National Assembly, of the 9th National Assembly. And this speech by the President of the Senate, distinguished Senator Ahmad Lawan, Ibrahim Lawan, PhD, CON, are the flag off of the Phase 2 COVID-19 vaccination in Nigeria at the Federal Medical Centre Jabi, Monday, 16th August 2021. Today is another milestone in the fight against COVID-19 pandemic. And I must commend President Muhammad Buhari, GCFR, and the Presidential Steering Committee on the successes we have achieved. The world was literally disorderly barely a year and a half ago when the pandemic broke out, and it is appreciable that humanity's response to the outbreak has been concerted. Earlier forecasts on the fate of Nigeria and African countries were warned of the arrivals of doomsday, but we again rose to the challenge through our innovative efforts and largely in collaboration with global bodies. The result has been our ability to minimize the impact despite sad deaths and disruption it caused to our economy. With the proven ability of the virus to mutate and the fact that it is still causing deaths and disruptions in sections of the world, we surely cannot rest on our oars. The Presidential Steering Committee, the Federal Ministry of Health, the National Primary Healthcare Development Agency, National Council for Disease Control, National Council for Disease Control, NCDC, and all agencies connected with the fight have been outstanding in providing leadership for citizens' response. This has led to the wholesome use of Oxford/AstraZeneca vaccine before the present 4,080 doses of Moderna vaccine donated by the United States government. If we add the 176,000 doses of Johnson & Johnson vaccines out of the 29,850,000 doses that the government procured from Afrexim Bank through the African Union, which we are now flagging off, we are increasing our confidence to sustain the fight. I'm aware of the innovations of the MPHCA that involves the whole family approach, a communication center, fine-tuning of the teach strategy, and the electronic management of immunization data, EMID system, and can say that the agency has been very creative. Creativity is, however, a continuous work, given the likelihood of continuing vaccine hesitancy and the unpredictable nature of the vaccine concerning citizen attitude towards it. This, therefore, calls for sustained ingenuity to be sure there is not just optimum deployment of the vaccines, but that there is also maximum application. Once more, I congratulate us all for these acquisitions, as I am confident we are again prepared for a high-quality administration of the processes. I wish us all well in the honorable task of keeping Nigerians well. God bless you all. God bless the Federal Republic of Nigeria. Thank you so much.
Thank you very much. Thank you very much. At this moment, we are going to move straight to the next item. But before then, would like to
They're not saying anything.
Yes, sir.
Standing on the existing protocol, I would like to say thank you on behalf of the President and Chairman of the Board of Directors of Afreximbank, Professor Benedict Etiorama, and thank the National Assembly and the Government of Nigeria and our partners, ABAT, who have worked assiduously with us to get to this level. As indicated, this is the first step, and we'll continue to work hard to make sure that the volume ordered by Nigeria gets here at the time agreed and in the quantity agreed. Thank you very much.
Thank you very much. Standing on the existing protocol, on behalf of the President, Federal Republic of Nigeria, President Muhammad Buhari, in my capacity as the chairman of the Presidential Steering Committee, I received this first consignment of the Johnson & Johnson vaccine ordered through the Afreximbank and also the African Union on the platform of ABAC for the use of the Nigerian people. I will now symbolically hand over this box to the Honorable Minister of Health, who will in turn pass it to the agency responsible for the administration of vaccines. And I wish Nigerians will come out in their large numbers to be vaccinated so that we can speedily get to vaccinate a substantial percentage of our population over the next months and weeks and years, because this is a long journey. It's not a sprint. It's a long race that we will be involved in. But the earlier we start, the better. Thank you for this opportunity. Honorable Minister, this is your program.
Thank you. The Federal Ministry of Health thankfully receives this consignment. We stopped vaccination over a month ago because we ran out of vaccines. We're happy today to resume vaccination with the receipt of this consignment and the assurance that vaccination against COVID-19 will not end due to shortage of vaccines anymore, but due to the fact that we have completed vaccination of all eligible Nigerians. We are aiming for over 70% of this vaccination. It is my pleasure and privilege to hand this consignment over to the Executive Director of the National Primary Healthcare Development Agency, Dr. Shuaib Pfizer, who is responsible for administering them into the arms of Nigerians and those who are resident in Nigeria. Dr. Pfizer.
Thank you, Honorable Minister. I want to express our profound gratitude to ABAT, Afreximbank, and the African Union for facilitating this procurement, and we want to assure all Nigerians that we will deliver these vaccines in the best interest of all Nigerians and to the glory of God. Thank you very much.
Thank you very much. While we're still here, can we please be upstanding in recognition of all the health workers